Good afternoon and welcome to today's webinar, COVID-19 Real-Time Legal Responses, Local Governments on the Front Lines, brought to you by the Network for Public Health Law. I'm Charles Strong, the Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of today's event. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select All Panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A session towards the second half of today's event. Your moderator for today's webinar is Kayleen Claridge. Kayleen is the Marketing and Membership Manager here at the Network's National Office, where she assists in the development and execution of our national marketing and communication strategy, as well as the Network's membership program. Prior to joining the Network, Kayleen worked for a nonprofit association management firm, where she assisted nonprofit scientific associations in the marketing of their memberships, annual meetings, programs, and services. Kayleen will be leading us through the rest of today's webinar, so Kayleen, over to you.
Thank you, Charles. At this time, I'd like to introduce today's presenter. James J. Hodge, Jr. is the Director of the Network's Western Region Office. He is the Peter Kiewit Foundation Professor of Public Health Law and Ethics and Director of the Center for Public Health Law and Policy at the Sandra Day O'Connor College of Law at Arizona State University. Through scholarship, teaching, and projects, Professor Hodge delves into multiple areas of health law, public health law, global health law, ethics, and human rights. His current work focuses on emergency legal preparedness and response, vaccinations, preemption, emerging and infectious diseases, and constitutional rights and structural principles. Now, I'll turn it over to you, James.
Kayleen, thank you so much, and greetings and good morning or good afternoon to everyone joining us today for our next in a great series of webinars that we've been conducting through the network. Now listen, this one's all for and all about local governments on the front lines. We're really delighted to be able to really address, hopefully in real time, some excellent and outstanding observations that are really being faced by our frontline practitioners at local levels. And to that end, I've got a good program for you in just a second. Let me give you a little different format here, too, of what we're trying to pull off. So we know everybody's time is of the essence at this juncture with everything now escalating around COVID-19 nationally. So to this end, I'm going to keep my comments even more brief than ever. We will be done in regards to formal comments in the next 20 minutes or so, getting right about to that half-hour point, and then we'll take all questions, comments, and thoughts that we can in the next half hour. If you've got a half hour to join us in that alone, join us for the next, and we'll look forward to it. Afterwards, we've got great questions and answers that are coming up momentarily. So without further ado, special call out to all of our national colleagues working at the front lines with local governments through the National League of Cities, through our great colleagues at NACHO, through our additional boards of health within NALBO. We're working with the Big Cities Health Coalition and the U.S. Conference of Mayors. All of these great colleagues have asked and clamored for this type of assessment. Let me tell you what I hope we can pull off here. We're going to be, again, brief. I'll give you a very quick update on U.S. legal preparedness and response. Let's talk most specifically about emerging roles for local governments literally on the front lines. What are your legal and policy challenges that we believe you're experiencing? And if you're not, you're going to get to ask us any questions about that both now during this webinar and afterwards, too, through submitted questions online. We will look forward to those. We'll talk about public health powers and constitutional limits. We'll give you some additional cues for additional resources. We'll end, again, with questions, comments. So sometimes you just have to take a breath and just really assess historically where we've been. This particular call out to our great colleague, Dr. Matt Carter, who's a state epidemiologist in Connecticut, who sent us this link over the weekend, was just too good not to pass up. So you're seeing literally a bulletin from September 28, 1918, the 1918-1919 last major Spanish flu epidemic that we saw. And the call out within this specific article where it talks about schools closed for the rest of the week and additional measures, talks about such extreme measures will not be necessary in this city as believed, and this is a smaller town outside of some of the bigger areas in Connecticut, but will be taken if the need arises through any great increase in the number of cases. We're at that point now with COVID-19. And if you just really take a look at what you're seeing on screen, what else catches your eye? Yeah, caught mine too. On the sheer left there, funeral directors and embalmers open 24/7, ready to take your call. On this one-page document that you see from Matt that he sent to us, there's 4 other advertisements from funeral directors in real time. This is getting serious fast, as it did in 1918. And to that end, what we're looking at nationally is highly alarming. So you're looking at now total confirmed cases. That's what best we knew this morning. 35,000. I didn't even have close to a tenth of that when we last presented known in the United States last Monday. So we're now getting a lot more data from effective and hopefully efficient testing across the country. 458 deaths. You're seeing major hotspots, as you would imagine, in New York, where literally half the known cases, almost half the known cases, are currently appearing. Seattle's still very hot. We have multiple jurisdictions in California that are hot. We have bubbles around some major urban areas, as you can imagine, too. But, gosh, this particular map doesn't tell the whole story at all, as we know. Part of the story is, not just where the numbers of cases are, but how significant that those cases arise. So, for example, we got this particular illustration from colleagues that we know are tracking this very closely in the Big Easy down in New Orleans in Louisiana. And what this particular chart shows that's very disturbing, it's a week old, but the data are still very consistent with it, is just look at the actual cases per 100,000 residents. Look at just, for example, in New York, how it has significant, per 100,000 per capita type of counts of 29 per 100,000. New Orleans is literally double that for what we know presently in the Big Easy. And then you've got Seattle, Santa Clara County. These are alarming data because you've got to understand, as we're seeing locally, this epidemic means different things to different communities depending on the size. Like for example, Cynthiana, Kentucky. Gosh, I'm from Kentucky. I know this small town. They had 6 cases reported very heavily in the New York Times. Why? Because they only have a population of 6,000. If they had more, this would be a very heavy, intense type of intervention in regards to the number per capita of sorts of things that we have to do in real time. What's the key message? This epidemic means different things to different communities depending on their size and capacity. It also means that we're taking things very seriously about what is available to us in regards to emergency powers. So we've documented this very nicely in the JAMA piece. That article is well worth checking out if you want to see what's the presidential capacity here. But to be sure, we're talking about multiple levels of emergency at every intervention of government. We're going to hone in a lot on the local governments today, but all of these emergencies make big differences for what and how the COVID-19 epidemic impacts your locality. So at the federal level, of course, we have multiple different emergency declarations. We've never seen this before, as you've heard me say already. An HHS public health emergency, 2 national emergencies through President Trump on March 13th, pursuant to the National Emergencies Act, pursuant to the Stafford Act. And now you're seeing states like Washington, California, New York just yesterday making a direct appeal to President Trump, which I believe he's approved already, to issue major disaster declarations pursuant to the Stafford Act for those jurisdictions specifically. President Trump has also invoked the Defense Production Act, not used it quite yet, as you heard during his news conference yesterday, but the invocation of it raises the level and issues extensively. We have also seen the feds put out their COVID-19 plan. Now, while we will not get into the weeds about what the federal government is specifically laying out in this 200-page plan of theirs, what I will say is it's starting to become clear about what and how far the federal government may go in regards to their real-time responses. Every agency on screen is responding in real time, and they're doing so in some profound ways, some of which impacts local governments highly directly, for example, like the waivers that you're seeing CMS put into place, with multiple other agencies also issuing a series of different waivers as well. These waivers, like for EMTALA, specific waivers for the HIPAA privacy rule, issues regarding to licensure requirements you normally would have to have before practitioners can actually work with specific Medicare patients, conditions of participation in Medicare and S-CHIP, and the telehealth allowances. All of these add up to facilitate some of what we may be doing at the local level, but the states and the localities is where the action's at, no question. And so what you're seeing on screen It's the most sensational U.S. map from an emergency perspective we've ever produced or seen nationally. Every state's in a state of emergency, multiple stars all across your screen. I wish we could keep track of them fast enough, revealing major metropolitan areas and some tribal governments all in declared states of emergency. These include big cities. They include smaller cities. I'm not able to track every one of them, but to be sure, we're really doing everything we can to show this is really as big as it gets from an emergency declaratory purpose. And what those states have done with those emergency declarations, you're seeing on the left column of your screen here. They've got a whole bevy of altered powers they can use in real time and are using extensively, like, for example, to procure resources in real time, to engage emergency plans, to get new resource allocations in place, to coordinate intrastate related efforts through including your localities and all the players within them on the front lines. We're engaging in mass levels of isolation quarantine and licensure reciprocity, controlling for price gouging in a lot of jurisdictions. I mean, it goes on and on, the types of specific public health powers available on an expedited basis that are being used at the state level. But of course, as we note, these local declarations of emergency that take on various different forms have import too. And some of what you're seeing in just this mere early selection of some of those initial jurisdictions, largely in California, but also in Hawaii and Oregon, what they were authorizing in relation to that. It's about getting emergency policies and practices in place, recouping financial costs, being prepared to bill up to the states and bill up to the feds as necessary. These measures also coming into play too. One of the neatest things is when you do see, as I bet you've experienced or seen in your jurisdictions as well, debates between locals and states over who's authorized to do what and how far those specific emergency declarations can go. The one we saw in Phoenix, right here where I'm broadcasting from, fascinating this past week. Literally, Phoenix City Council contesting and challenging whether or not Mayor Gallego could issue an emergency declaration and close down bars and restaurants in the city, even though that's pretty much what we're seeing in major other metropolitan areas. So there was considerable concern about how far the mayor might go with this. Ultimately, the council, in a late-night discussion on Friday this past week, did decide to ratify her declaration. Probably didn't hurt either that Governor Ducey in the state of Arizona had already issued an order basically requiring the same thing simultaneously, a mass order we'll discuss later about business closures. What we're talking about and what we're seeing, particularly on the front lines, particularly at the local level, is what I like to call legal triage, because it's what we're doing. We are literally engaging in every way possible to construct that favorable legal environment that's so essential in these emergencies. Because we have changed the legal environment by declaring them, we've got to now figure out what and how do we prioritize those issues that facilitate the types of public health responses that we know are necessary, we know we're trying to implement. We've got to go from what you're seeing on the left side of the screen, from basically the tempest to calmer waters. How are we going to get there? We're going to have to do it by assessing and applying changing legal norms. That's happening, working with your legal counsel, or if you are legal counsel, you should be at this as hard as any healthcare worker trying to work on the front lines, because it's that essential. You got to identify those legal issues. You got to find solutions. This is not a time to, throw your hands up and suggest we can't find any pathway to doing what's in the interest of the public's health. They're there, and we can help you find them if you need it. Explaining legal conclusions, collaborating with partners. This is tough sledding, unquestionably, because what types of issues are starting to percolate and prioritize across localities are just, what roles are we supposed to play against this backdrop? We're within a county-city type of maneuver. We're trying to actually assess what our local city may do. It's contrasted with the county. We got federal influence, state influence. We're trying to figure out how far our home rule may go. We got preemption-related concerns that may extend from what and how the state's overridden particular things that we might have done in non-emergencies. Gosh, the biggest question, however, I think many of you all are facing from a local perspective is, where's the money? This is what the U.S. Conference of Mayors and other enterprises, as we've noted earlier on screen, were highlighting quite well in relation to the money to be set aside specifically for response efforts at the local level. They're asking for $250 billion among that multi-trillion-dollar package that Congress is actually considering right now. The money is essential because the array of local services directly impacted in emergency events at the local level cannot be discounted. all of the different blue sort of icons you're seeing on screen give you a sense of the types of issues that are being experienced by cities responsible for providing these local services. Issues related to, for example, water-related and other utilities. Will we shut those off? Would our utility company be, in a situation to do that? Can we stop that? The answer is, in a lot of jurisdictions, yes, you can. We've seen specific governor orders and local orders to not allow for shutoffs. We've seen changes in how police may be responding. We've seen even issues related to the hazards of waste collection, like waste that include COVID-infected related materials coming out of homes or businesses. We've got employment issues beyond compare. The out-of-work-related concerns and how we respond to that through our emergency declarations at the state and local level make a big difference. We've got social services involving housing that have led to significant concerns over evictions. This will continue to be an issue. A lot of governors have shut that down through their emergency orders, and we've seen some really good efforts at the local level, too, to basically say, put all evictions on hold during the course of this event. The local capacity to make that happen is extensive. And then one other call out in regards to what you're seeing on screen with mobility. So one neat initiative would be about how we actually might use existing resources, but quickly through a joint use agreement. And to that end, we're seeing those opportunities that may arise for declaring and using contractual or other arenas very quickly, systematically at the local level. But you're seeing on the right side of your screen the most important point that we're here to debate and to discuss. What and how, from a local level, are we going to implement the public health services in real time, not for just the week ahead, maybe for weeks on end as we consider all these different issues? Why is this so essential? We got to do all of this right at a local level, because local service failures might be the beginning of what and how the American public begins to see a breakdown that is not something local governments can absorb, not well at all. What we want to avoid is any failures that will actually lead to local service-related issues on the public health basis or others, as you saw on the prior screen, because that's going to be problematic. These are the types of big-time public health legal issues that are being thought through nationally, and they're coming down and playing it out on the front lines as we see currently. We're going to discuss each of these in brief order and be quick about it because, again, we want to make sure to get to your questions and comments as thoroughly as we can. Let's just make sure we are conscientious of one overriding factor that consistently is playing out and will be a theme of each of these. Hey, we're having to balance very differently and in real time constitutional concerns that underlie these types of interventions. We're working at the local level, and to that end, we have local government implications that may have constitutionally be at the state or federal level. And those constitutional issues do not go anywhere with emergency declarations or waivers, but they do get recalibrated, and that's what you're seeing on screen. Individual interests still at play in regards to privacy and religious freedoms, equal protection, and due process, but our communal interests in the types of public health powers that we're implementing locally and on the front lines is playing out in a big way. We're recalibrating, but not dispensing with those constitutional concerns. We're doing it with some very effective local examples of some of the best stuff happening that we've been scouring the nation and hearing from localities on, like communications. I really must call out our great colleagues in Harris County, which is the Houston area of Texas. Communications they've done down there are fantastic. Check out their website if you want to see just how well a big metropolitan area can communicate with the public. Real-time information. They're not candy coating it. They're not mincing it. They're telling straight up, here are the risks, here are the issues. They even have a counter on their webpage showing, the numbers of cases and who might be impacted, not names, obviously, but who's impacted and what the outcomes of those cases are. It's real time, it's really valuable, and it's the sort of public health communications that make a difference. Screening and testing is changing as we speak. Vice President Pence literally just 2 weeks ago said, Americans, let's get tested. We've got the chance to actually make sure every American with new infusion of testing can get the subject or the information they need about their COVID status. Well, that's changing. I mean, literally on Saturday, you're seeing the Washington Post literally report on what New York, California, and some other hard-hit parts of the country are actually doing. We're basically having to already ration or allocate testing to those persons who are hospitalized for the purposes of containing the virus. We cannot continue to actually test across a wide swath of Americans in some of these hot spots. We've got to confine those tests to specific areas where people are showing up in hospitals needing for purposes of confirmation, that sheer access to the limited tests. This is changing, and whether it's affected your jurisdiction locally or not, be prepared for the testing mandates and such change along with it. Crisis standard of care cannot be under discounted or discounted at this point in time. I would like to be able to give you the full gamut of what we know about what's happening nationally in crisis standards of care, but to be sure, it's serious. And it's going to get very interesting this week. You'll see a lot more information on this soon. We're talking about the types of standards you shift to when you have to make very different decisions about patient care because of the circumstances of the catastrophe around us. COVID-19 is requiring this in real time. There's fantastic national guidance on it through the national academies. There's a lot more coming out affecting and directly related to COVID-19 in the very near future. What types of legal issues on the front lines are you facing? So you're going to face and have to think through with hospitals and others at the local level the types of issues around coordination, allocation of related resources in real time, who's going to be paid what, under what circumstances, how do we get reimbursed for some of this, the licensure concern as volunteers potentially are called in and working through licensure concerns, scope of practice issues, what can a nurse now in your locality do that he or she couldn't do before? That's changing. The patient's interests, they're at stake, big time. How far do we go in relation to reshaping that? There's duty to care issues. Gosh, I've heard about this in California and other places already. You know, when do we have a duty or a responsibility to healthcare workers to, first of all, provide for their protective equipment, but also can we dutify them to still report against the backdrop of the risks that they're taking in real time? Uniformity is going to be one of those factors that flat out is going to play, very big politically, nationally as we speak. What and how these crisis standards developed in real time assimilate each other, at least within a specific state, will be quite critical. But then across states, gosh, it's going to be very interesting to see how we play that out. Liability, front and center, so often. Why? Because healthcare practitioners are worried about, for good reason, their potential liability against the backdrop of the extremely tough decisions ahead. Now, the good news here is they can be worried, and there are concerns over liability, and we've seen examples of that from the past with Katrina and other specific events. There is also an umbrella of liability coverage that we have literally, in the National Academy's work and so many other arenas, talk about extensively. If you can fit from a frontline practitioner perspective under this umbrella, under these specific themes, you might be protected from ordinary liability type claims grounded in mere negligence, not gross negligence or willful misconduct. But if you're engaged in some decision that ordinarily might be viewed as negligent, we might have protection for you under this umbrella. Get crafty and creative about how healthcare workers in your jurisdiction might fit. We got some good ideas for what to do if you don't see them fitting within these specific themes directly. Social distancing, gosh, we have been all over that. We had a special webinar just this past week discussing it, but let's just hone in most particularly on some of those issues that are affecting locals. The easy part is when we have voluntary closures. And so all of these specific enterprises of what you're seeing on screen all made some voluntary decisions to close or cancel. That gets easy. It's a lot harder when we have to actually close these jurisdictions. We still have multiple states that have not mandatorily closed schools in the United States. You might be, within a locality representing one of them, or literally trying to decide when and how do we actually, shut that or hit that switch and close down these schools. But who's going to make that choice? How long are we going to keep them closed? And on what actual legal grounds do you close them? Is it purely pursuant to the governor's orders at the emergency level, or do you have additional legal authorization for that? We've got material on that and be happy to cover it in questions and comments in a moment. The limitations on assemblies has become really quite profound. So CDC was issuing various limitations early on as kind of recommendations. The White House amped that up through President Trump last week when he basically said, hey, we're working with CDC recommendations too, and no more in-person events of 10 or more people. Nationally, and you're seeing it locally, that people are flouting this as well. They're not necessarily engaged in that level of distance, and it has become quite a factor and feature that's played out in a very significant way, local enforcement and otherwise. Who and how do we actually impose these assembly limits against the backdrop of the First Amendment? Hey, our answer to that is not easy, but at least it's simple. We are going to put the First Amendment out front as absolutely critical to observe at all points in time and to counterbalance against these assembly limits. But we will not counterbalance that against the backdrop of protecting the public's health for defined periods of time while we're trying to tamp down the curve against the backdrop of known spread of COVID directly related to the fact that these assemblies could be leading to it. So you even saw today in the New York Times, gosh, the coverage specifically highlighting just how even just mere familial clusters of just 8 to 10 or so can lead to hotspots in specific jurisdictions. So we may have some additional guidance coming forward on assembly limits in the near future too, and watch out for that in relation to the impact on your locality. The constitutional challenges have been interesting on all fronts, and I promised I'd raise a few of the local ones, but this one just really caught our attention. When multiple persons actually sued Governor Chris Sununu in New Hampshire, basically saying, hey, your order of limiting us to 50 or more people in regards to assembly limit is unconstitutional. Said some of the parties pursuant to that claim, we can choose to assemble if that's our desire. What cannot occur is one man in a position of power deciding to strip us of our rights in the name of safety and without due process, or so they alleged. Actually, the Merrimack County Superior Court said, actually, yeah, it can. We will limit your assemblies, and we'll do it on a constitutionally grounded fundamental rebalancing of just how far that right to assemble goes against this type of material threat. And then you have issues that relate to quarantine and isolation. We've discussed these extensively. These are serious public health powers. It's about separating persons who may have been exposed for periods of time, and it's about isolating individuals when they're known to be infected. Frontline practitioners are having to do this. We know this in real time. You're doing it pursuant to emergency orders. You've got a whole litany of state laws that allow for this, but it's getting dicey fast in relation to how you actually implement quarantine and isolation legally while adhering to what we typically would use as best practices. So, for example, how do you maintain safe and hygienic premises when people are being isolated at home or isolated in specific settings, which you really can't assure are going to be safe and hygienic? You do the best you can against that, but you do have to monitor and care for individuals in isolation. You got to at least have, for basic necessities, some forms of means of communication. Always use the least restrictive means, like, for example, home quarantine as contrasted with quarantine in specific settings, notwithstanding potential future guidance on that, and it terminates the moment you can terminate it. Although, with isolation, we're clearly seeing it can go on lawfully for weeks because of the incidence and how far this specific disease, COVID-19, takes to clear one's system. The types of issues locally that are showing up is just exactly like what you're seeing from my home state of Kentucky in Nelson County. So here you got an individual, and I guarantee this is playing out in almost every state at some local level, of the recalcitrant who just flat out refuses. He's COVID positive. He refuses to isolate. He literally tries to check himself out of a hospital. Nelson County judge there basically said, I'm actually going to have to force you into a self-isolation. But at home, we're not paying the expense of all that. He's stationed now at home, this individual, and consequently has law enforcement literally almost at his doorside 24/7. Hey, we don't have local resources to do this for every person that would be potentially recalcitrant. And how far we actually can go with the local abilities to pull this off in real time as COVID spreads even more extensively is going to be not only interesting, but potentially legally problematic for what we may have to do, as we'll get to a little bit later. Quarantine isolation litigation at the local level, gosh, Costa Mesa, California suing the feds, San Antonio suing the feds, both basically having their cases dismissed after specific interventions are done. But these types of litigation battles are happening locally and doing so against that sort of backdrop of trying to make sure that the potential spread of COVID doesn't impact a particular locality. The grounds on which these claims may be raised are spacious at times, but at least from a litigation perspective, you're seeing them emerge locally. Shelter-in-place orders. Let's just stop for a minute and really try to get a little clarity on what's exactly going on across what I think now 14 states, if I saw right before our webinar started, Michigan is now added to this. We're talking about shelter-in-place initiatives that are creating an anticipation, an expectation, that is, among persons within these communities to stay at home and to do so for extensive periods. If you're not engaged in essential work, you need to stay at home. If you have the capacity to avoid travel at all costs, please do so. The consequences of orders like what you're seeing in San Francisco and across a lot of states now, big population states especially, is really about whether we're actually going the route of creating something of a lockdown. You know, the media is all fixated on that. It's not actually a lockdown. It might be best considered a virtual lockdown, but as I've said before, I see it and actually it can be legally defended much more as what we might call a public health and safety zone. That's what we're attempting to create. And one epidemiologic analysis after another says this is our best bet to tamp that curve, to work through these specific initiatives. Are they challengeable? Yes, they are. And so what you saw in Pennsylvania over the weekend was very interesting when Governor Tom Wolf actually rescinded in part some of the order that he created for the entire Commonwealth, when he actually had to literally say there's a few more exceptions than what we might have imagined because of disdain that had arisen over economic impacts. There were legal challenges led by a law firm and a gun store. The outcome of that case is actually right before us here in the Pennsylvania Supreme Court. They rejected it. They said that specific claims are not legit at this point in time, but still Governor Wolf kind of adjusting for those orders and allowing for a robust waiver process. The real question that came out of the Harrisburg Press reporting on this case over the weekend was, hey, will localities actually enforce this order? Not so much in Philly, not so much in Pittsburgh, but in smaller locations across Pennsylvania. That's a question for law enforcement in a lot of localities as well. How far will we go in enforcing orders like this and for what duration? And then you've got the challenge that emerged in California. When you now see an emergency hearing being called for in the near future by a U.S. federal judge, David O'Carter, to address claims by the LA Alliance and others, basically suggesting you forgot about us, shelterless persons. Your plans, your initiatives, your orders that have been put into place leave us on the outside looking in. In fact, that San Francisco order I just showed you literally exempts homeless persons from the actual shelter-in-place initiatives, basically all but saying, we strongly urge you as a homeless or shelterless person to find shelter and, local governments do what you can to provide shelter for those persons. And that's in San Francisco that has such an interesting approach to how best to address and work with homeless populations. These are remarkable legal times, and the types of challenges locally that you're seeing, I guarantee you're playing out in various settings as well. There's so much more information we can offer you through our network website, and we hope that you find some of these specific links particularly compelling and helpful towards that end. We are at that juncture where I want to give out my special thanks to Leila Barraza, to Michelle Natrika, to additionally two of our great students, Claudia Reeves and Erica White, for their contributions always to everything we're doing in real time. Now, without further ado, you've got questions. Let me turn it back over to Kayleen for starting us into those questions, and thank you for your time.
Thank you, James, for your expertise and for this excellent presentation. We'll start with the Q&A. Many small, semi-rural, and rural jurisdiction governments have substantial responsibilities, but almost no legal resources. Can the state attorneys general set up legal advisory hotlines for these governments?
Oh, I love that question. I sure wish I knew which state it was out of, because I've seen AGs in some jurisdictions suggest they're doing that basically, not prepared to do it. They're doing it because they do see and know that what and how actually these specific services from a legal perspective are going to raise some profound, difficult issues in rural related parts of our country that try to, basically implement something that is very different to do in a rural location as contrasted with an urban location with lots of resources, lots of law enforcement as necessary. Great question. We would be happy to actually try to connect the dots if we know of the specific state in mind later, and really try to make sure you know where might you turn for that type of guidance. But I like that suggestion because we're seeing some AGs in some parts of the country issuing orders at the gubernatorial level, following up with that type of legal assistance. Great point, and thank you. Kayleen, go ahead.
How are joint use agreements typically used? Can you provide an example?
Oh, sure. So one I really love came of our great colleague out of Indianapolis, Indiana, where they basically said they were trying to find a way to utilize school buses for the purposes of delivering specific medicines or other services within their sort of Marion County area of Indiana. Now, this is a really neat initiative, and mind you, school buses are not to be used for this in general day-to-day sort of functions. How can you quickly get that implemented? How can you actually make that happen? Oh, you could actually pursue it potentially through some sort of immediate order through the governor or through the Marion County executive, but you also might be able to instantaneously create a joint use agreement, which we use in routine events. This allows for jointly held, or basically school or other type property that might be used for the purposes of community benefit to be used specifically for that purpose. And I think a really well-tailored, instantly executed jointly use agreement could actually make that happen in real time. It's a contractual route as contrasted with necessarily having to seek gubernatorial orders or getting signed off from 15 different persons within local or state levels. That specific contract may actually expedite the use of resources like within schools or other specific publicly held resources for COVID-19 response efforts. So to that end, there's some models out there that may work really well, and we can certainly educate and provide some of those links if you separately email me also. So go ahead, Caitlin.
How do we navigate conflicting orders, state versus local? For example, a state that is requiring state workers to still go into an office building that goes against a local hunker down order asking for people to stay home except for essential services.
Oh, I love that. What a great observation. And it's great because it's happening consistently. State and locals not agreeing on what specific course of action to take. So you saw me raise it with the Phoenix example, where literally someone on the city council in Phoenix basically saying that they did not want to entertain or go forward in relation to these business closures. This one's even more profound. You got a local government here under this fact scenario trying to implement something that's actually in the fuller interest of the public's health, engaging in greater social distancing, and you potentially have a governor who, whatever point of view, suggests that that's not necessary at this point in time. I'm going to suggest against that backdrop that I think the local government, so long as it has sufficient home rule, although that can always be overridden by a gubernatorial emergency in this specific example. But so long as that local government has sufficient home rule to say, in our jurisdiction, this is how we do it for the safety and sanctity of the health of our community, I think they might be in their right mind to actually go forward and seek to implement that, awaiting some sort of negative direction from the governor's office telling them you can't do that. I would suggest if they're local employees or persons, working within local businesses, they should have the capacity to pull that off. If you do get kickback from a governor's office in relation to it, you got to take that argument up with the governor. You've got to really ascertain, what purpose would there be in relation to failing to allow implementation of that local order. We've got the public's health interests in mind. You've got new evidence saying that these hotspots develop from even just small clusters that occur in specific localities, like happened in Cynthiana, Kentucky, that I showed you earlier. Now this intervention at the local level, I think, makes more sense than ever. It's a dynamic that hopefully will play out well, but I kind of like, if you think it through on that level, you may very well find that the answer comes clean against the backdrop of a public health-driven initiative. Kayleen, go ahead.
Can you point to where we can find the actual court rulings on these various challenges to public health orders?
Oh, absolutely. Thank you for asking. So one of the things that I think you'll find helpful, as Charles mentioned earlier, is right after this webinar, and he's just really great about this. He's been working in real time, as we all have in the network, for weeks on end. He will post the version of the actual PowerPoint that you see, and that version has hyperlinks that are active. You can actually go right in. You can hyperlink. It'll take you right to either the media issue of which exposed the specific litigation or the order directly. And if you don't see what you're looking for there, you email me at that specific address you're seeing on screen, and I will make sure that you get it in real time.
A question about possible authority to release the location of positive COVID-19 patients to law enforcement and other first responders.
Okay, so here's where things get dicey, right? So let's be conscientious. Individuals infected with COVID-19, have specific rights too. They have rights to privacy. They have disability issues at stake here. We need to be conscientious of that. So against that backdrop, you really have to assess, well, how much information should we be disclosing through public health or healthcare-related purposes, and who really needs access to that? I'll take you back, for example, to what I was telling you about in Harris County in the Houston area in Texas. They've actually got on their website for COVID-19 a tracker of all the cases that they know about that are positive in, Harris County. And it'll actually tell you the name, it'll tell you the sex, the age, and the status of that specific case. And that, for most of the public, is all you need to know. But law enforcement, EMS, and others working on the front lines may have an additional need to know more information. It might seem like a privacy violation to disclose, for example, in advance of an EMS worker showing up on site to pick up a patient who may or may not be known to be exposed or infected with COVID. It may seem like a privacy violation to advance that information to that specific individual. What you're going to find is generally that's not. And even under the revised versions of what we're seeing interpretively through the HIPAA privacy rule, there's more than enough room in an emergency for that type of disclosure to be made for that limited purpose, to protect law enforcement, to protect EMS, to protect anybody working on the front lines from additional advanced exposure, even if they use every precaution necessary for universal purposes. Hey, additional information that makes sure they know a little more of who they might be dealing with in regards to known infected patients might be quite legitimate in relation to that audience, but not for the public and not for the media. That's a very clear distinction that we need to make from a public health perspective, respecting the privacy to the fullest extent we can.
Tribes have the option of declaring a major disaster emergency under Stanford Act, either directly through the president or through the state where they are located. Do you have some thoughts of pros and cons of going through the state versus the president?
Okay, interesting point and really neat, nicely stated. Out here in Arizona, we have, within a 4-state region, Navajo Nation, one of the biggest tribes, if not the biggest tribe in the country. They've issued emergency declaration already, and I don't know whether Navajo Nation, although they have quite a few cases now we know, I don't know whether they've sought a Stafford Act emergency declaration too. But, I think both routes may make the most sense, to be quite honest. If your tribal authority has the ability to issue a tribal emergency, do it. You don't have to do that to pursue a Stafford Act declaration through the president for approval, but do it for the purposes of making sure that you're empowering full authority or consistent with state government, all of which are in states of emergency, so you can rest assured you don't have to ask anything more from state government. They've already done it in every jurisdiction and 5 of our territories. But I think at the tribal level, if you've got that specific authority as a sovereign jurisdiction to make the declaration, you're at the right time to do it, and it would not impact or be the means through which you'd be prohibited from doing so through the Stafford Act as well. Why would you go the Stafford Act route? You want to be in line for what states are in line for too. Some of the resources that may be funneled through FEMA directly to and a sovereign entity like a tribal authority or states, and to that end, I think that specific request might be one to make simultaneously. I hope that helps a little bit, but to be sure, it's one of those decisions now that virtually every sovereign tribe in that capacity should be thinking through systematically. Caitlin, go ahead.
Are any states actually expanding local power to respond by lifting preemption restrictions or temporarily expanding home rule authority? We need some models of new state and local partnerships, not just the tensions and conflicts.
Well, that's an excellent observation, Kayleen. I like that as a question for sure. And, I'm not phrasing it so much in the preemption language, and I'm only saying that because what states are empowered to do in regards to local authorities is to vest within them a host and series of objectives and powers that they will have consequently in relation to executing state-based directives. And so what's really important about these emergency orders at the state level is that they couple with specific authorization, because states do control for, the localities as far as some of the key issues and some initiatives that they may do in COVID response. States are empowering local governments, and I think that's the right framework to assess it. Governors have such expansive public health emergency powers, and all of them are using it, all with the directive, hopefully, of basically saying to local governments, let's not let home rule limitations or expansions get in the way of how we effectively respond. I like that question earlier about when a local wants to do more than what the state may be suggesting is necessary. I see room for that, just so long as the state would not shut that down, and I sure hope it wouldn't. But the second thing in observation in regards to it is as follows. We're at that juncture where state government can now empower locals to do things they weren't empowered to do before. We're at that juncture with these emergency orders, or with whatever traditional sort of balance of power that we were seeing state to local, and that does change, as you know, across local systems, local boards of health, or local health systems, as well as just within city and counties traditionally. That balance is changing in real time. And it's a careful one. It's being negotiated systematically in some jurisdictions, most important to this observation is the following in regards to how to best assess it. If state and local governments are coordinated across their response efforts working to address the public's health with unified vision, you're going to get the better result from that. So I don't particularly like to see when bigger metropolitan areas are actually battling with their state governments over the next best steps. Coordinated intrastate efforts essential at this point in time. Kayleen, good question. What else you got for us?
What are the reporting requirements for state and local governments with respect to COVID-19 cases, morbidity, and mortality? Is this entirely governed by state law? What legal obligation do they have to the public?
Oh, now as far as reporting, let's say, and I've seen this, for example, in some early illustrations in Ohio and some other jurisdictions. Yeah, I think you're going to see reporting largely controlled now through the state departments of health and otherwise essentially saying, here's what we need reported through your local department, through healthcare workers, funneling up through local departments. Here's the type of information we need, and here's exactly when we need it, which is pretty much ASAP on any of these specific cases for good reason. So as far as that directive, I think you're seeing that play out at the state level, but locals following in line with it too. I think bigger metropolitan local boards, local health enterprises, particularly at very sizable sort of big city type initiative enterprises, they may seek additional information and they may very well need it for the purposes of their frontline response efforts, but a lot of it driven by the states. And states are listening closely to CDC. While they're not necessarily funneling up to CDC the complete package of information, CDC is issuing new surveillance guidance and standards that states are listening to very closely as well. Kayleen, there was a second part to that question. Did I answer that too, or what was that?
No, I think you addressed that.
Oh, fantastic. If I didn't, whoever asked it, it's a great one. And let us know via email. We'll jump on that and get you some additional information. Go ahead with what else?
What are the legal requirements for the best practices you listed on the slide about isolation and quarantine? Do any states have specific language about the food, shelter, healthcare, etc., that they will provide to people in isolation or quarantine at home?
Oh, yeah, you bet. I think you're seeing that slide on screen right now if you're referring to this one, the safe hygienic premises, monitoring care, basic necessities. When we did our social distancing webinar last week, we actually went into these a little bit more in detail, but not extensively. There are legal requirements for each of these, and I would be more than happy to actually nail down a very good resource of which we've seen in some states, or particularly at a local level, that might actually spell out, here's what we're talking about, here's what you actually need. But the only thing I want to caution about in regards to slide 14, or the slide here that you're seeing on screen, the only thing I really want to caution about is, hey, we're in a fungible, flexible isolation and quarantine environment here. And to this end, what and how our best practices in regards to isolation may work in a non-COVID environment as we use them routinely for everything from tuberculosis to other conditions, we are nationally having to see some flexibility around this. And so the best observation I can make is these are now best practices. Are they absolutely essential to a constitutional assessment of quarantine isolation right now in regards to the national emergencies we see ourselves in? Quite possibly there's room for some maneuvering here, and that's the important observation I want to make. I'm realistic about one thing on screen. This is hard to pull off in hotspots right now in multiple parts of the United States, like in New Orleans and other places I was mentioning. This is going to be hard to pull off. You are seeing, and there will be requests, I think, made in the very near future, that some very substantial communities, very large populations, will be asked very likely to start finding definitive places for persons who are isolated with COVID, that we need to house those persons for a duration of their condition. And that's because of just the significant numbers, the risks that are being played out for having persons who are isolated at home, of which they can infect other members of their family. I don't know how far this will go, and I'm not going to make bold predictions, but let's just be sure when they start parking, ships off the coasts of California and New York, as President Trump has indicated yesterday in his press conference, those ships are there to actually cover patients non-COVID related so that we can actually carry out some additional specific measures for persons who are not COVID related within a confined ship environment. What's important, though, is it's about where and how persons are placed in ways so non-traditional to what and how they might play this out nationally, that we're just going to have to wait and watch to see how that works on a local level. I would start ramping up for it locally, especially big city initiatives. Start thinking about what and how we're going to set aside specific space. Kayleen, that's a tough question. It's changing in real time. What else you got for us?
What are other local governments doing to enforce governor's shelter-in-place orders? In other words, are local law enforcement issuing tickets, custodial arrests? Obviously, voluntary compliance is preferred, but what if individuals or businesses refuse?
Oh, I know. What about the recalcitrant who says, not only I'm not interested in meeting this sort of public health and safety zone, I am going to publicly flaunt it. I'm going to, assemble and do so in ways that even as the New York Times reported just this morning, we're going to have our wedding, we're going to have a special event, we're going to assemble in this specific way at this business that's operating, outside the bounds of the governor's orders in that respect. I am not about to say that this is a significant problem yet nationally. The longer the duration of these specific shelter-in-place initiatives, the greater the chance that some people will simply, run out of steam in relation to how much they're willing to continue to participate in these. To that end, as we've been assessing with a lot of our national partners, these shelter-in-place orders from governors do have get-tough policies. They do have the capacity for authorizing arrests as needed. They have the capacity for issuing serious fines and even jail time against that backdrop. I think what governors are anticipating, however, is that those are going to be very seldomly used, that those are about the pure recalcitrant who simply on repeated occasions will not engage with social distancing measures as we've seen, much like the case you saw in Nelson County of the person who's literally got COVID-19 and trying to simply, evade isolation in that regard. That's the prediction about why governors put such serious measures into place. But the tough talk from Governor Hogan in Maryland, from Governor Newsom in California, Governor Cuomo in New York, tough talk about what expectations we have for Americans against this backdrop, probably all but meant to dispel just the idea that, your engagement in non-social distancing type behaviors presents no risk to others. It does present risk. They know it. We all, from a public health perspective, know it. Kayleen, the best I can answer that is as follows. I would hope we don't see significant mass need for law enforcement intervention, but governors did embed that in many of their orders against that backdrop with some rather serious penalties at stake. I just hope and believe we will not have to use them extensively in the near future. Go ahead.
I'm getting asked whether well persons can take walks. A county health officer issued a shelter-at-home order with exceptions for food, medical care. Should orders include walking with social distancing in exceptions?
Oh, yeah, as far as the actual capacity for persons to walk out of their front doors, to get onto just parks or streets or whatever, although honestly what you saw a little bit that was so shocking is how many national parks literally were still open up through not long ago and had thousands of visitors, which is just almost surprising, as you can imagine. But the whole premise of it is from a legitimate sort of public health and safety zone, a legitimate virtual lockdown does allow for persons to move about in safe ways. And to be sure, most of the orders that I'm seeing, and we're actually pulling from local and state governments, include that type of exception. If you want to step out, take a walk on, in the park or what have you, keep a moderate distance, the 6 to 10 feet sort of rule, and probably even better in open air just to keep even further distance, totally legit and not a threat to the public's health from what we know. Consequently, it's built into a lot of these orders. For sure. If it's not built into that order, I would actually seek it, or maybe an interpretation at whatever local or state level necessary for that purpose, because it may have been an oversight or something to that end. But to be sure, this is not about the type of lockdown that under any circumstances should mean do not leave your premises. That in and of itself presents its own public health risks to persons on a lot of different bases. And that type of exception for walking or jogging or engaging in some sort of exercise in a non-participatory team type way is not only legit, but just a very good feature of what you see in most of these orders. Kayleen, what else?
You note the potential for additional litigation to arise. Can't a governor just ignore any contrary opinions if a court's decision gets in the way of emergency response efforts?
Oh, that's good. I like that. That's a super sharp observation because you picked up on something here really quick, which is, I said earlier, governors pursuant to their emergency orders can waive specific regulatory or other or statutory interventions that get in the way of potential emergency response efforts. That also could be true for a judicial order that interferes with these specific emergency responses as well, unless the judicial order is grounded in a constitutionally observed violation, which I've noted many times cannot be waived systematically. So that's going to be a dynamic situation where you have a judicial order that comes down from some state Supreme Court or appellate court or federal court at some juncture, basically highlighting that a particular implementation for social distancing or otherwise at the local level constitutes a constitutional violation. That's going to be very interesting. A governor and or locality cannot look past that or waive that, but the question would be, can they modify their social distancing measure to better accommodate that? And if so, I think it's still going to have plenty of room to land. But great observation. Important that you recognize how far those waiver authorities might go and where they might end. We maybe have time, I think, Kayleen, for one more great question, and I'll be brief in my response. Go ahead.
Okay. What are we going to foresee with regard to the work by the National Guard that has been activated in each state, and how will their work be coordinated with local governments?
Okay, nice question. I'm going to give you what I think will be an answer to this you can live with for the moment, but I need you all on this specific purpose to be ready for that to change. The answer I think you should be ready to live with is what governors are using currently our National Guard to accomplish, and that's real-time efforts on the front lines, working to do everything that we can imagine to make a difference within larger urban areas and soon may potentially even in some less urban or more rural locations as well. It's about support. It's about essential personnel, screening, creating hospital-related zones or screening maneuvers, trying to actually do the best they can to maintain, some level of modicum of order where necessary, not engaging in law enforcement directly, but perhaps monitoring for just early signs of any specific issues. That's what the National Guard not only is trained to do very well, but being used very effectively in California and so many other states as we speak. Good uses, highly consistent with legal intervention. Governors do have control over that, as President Trump notes yesterday. Where does it get interesting? If their objective does become law enforcement, or we have to go that specific route because of any civil unrest or otherwise that may occur, none of which we're seeing in any substantial way in the United States at this point in time. It will get interesting as to a full assessment of how far National Guard can go and how far governors would authorize those Guards persons to go. Now, that will be an interesting observation we will not know the answers to until we see exactly how far our interventions from a public health perspective take and just how successful they are in keeping within the realm of full attention of the American public to their civic responsibility with diminishment of potential civil unrest along the way. That one slide I showed you earlier, I'm wrapping up with this for my point about showing all the different local services that at the local level you're responsible for doing, keeping those running, keeping those active, making sure people have that they can rely on at the local level will go a long way towards preventing any of those specific incidences. I hope that's where we are just a week or two from now or a month from now. But most importantly, the National Guard playing out roles that are very effective at this point, hopefully for public health interventions guided by governor and other specific state agencies. Kayleen, thank you for all those great questions. I'll turn it back over to you.
Charles, would you like to do the closing for us?
Yes, so thank you both Kayleen and James, and thank you all for your participation in today's webinar. Just a few final notes to all of our attendees. If you submitted a question that did not get addressed during our Q&A session, don't worry, we'll be reaching out to you to ensure your question gets answered. Also, all attendees will be receiving an email from the network with the video playback of this webinar, as well as a link to our brief webinar survey. The survey takes just 1 minute to fill out and provides us with some really great insights, especially in regards to what topics you would be interested in for future webinars. Also, join us this Thursday for a webinar on COVID-19 and crisis standards of care, where we will examine the decisions healthcare workers must make to address scarce resource allocation, ethical decision-making, provider liability, and other legal issues. Learn more about the webinar and view the network's collection of resources on the pandemic at networkforphl.org/COVID-19. Finally, registration is open for the 2020 Public Health Law Conference, where attendees will learn legal and policy tools to address fundamental drivers of inequity, promote health and well-being, and save lives. You won't want to miss it. So that concludes today's webinar. Thank you all for attending and have a great rest of your day.